Alright, let's talk about core muscles and how they can affect your back pain. If you're suffering from back pain and you're in your 40s, 50s, 60s, 70s or even your 80s and you think it's too late to take care of your health and go back to sport, then you're wrong. Stick around to the end, I'm going to show you how to get some help. I'm Luke Savage, the CEO and the Senior Osteopath at Worthing Osteopathic and Wellbeing Clinic. Here's the problem, let me explain. Unfortunately, from the age of about 40, the occurrence of back pain increases. Why is that? Well, several studies have demonstrated the impact of being too sedentary on lower back pain. Your muscles are there to be challenged. A lack of activity and a sedentary lifestyle leads to your muscles becoming weak and therefore back pain. This can make you feel old, frustrated and disappointed that your body is not what it used to be. Your muscles play a really important role in your well-being and help to stabilise your body as well as keep your balance. A lack of strength predisposes you to back pain, which stops you from doing the everyday things that you love to do, whether it's doing a bit of gardening, going for a walk, or being out on the golf course. This is why it's essential to get back to exercising. Physical activity is reported to reduce your chances of getting back pain. By the way, if you can relate to any or all of these, then comment core muscles below. Right now, I'm going to share with you 5 exercises to reduce your chances of back pain. No matter how fit or unfit you are, you should be able to do these exercises. Each of these exercises targets one or several of your core muscles and can even be done from bed. The first exercise is to strengthen your pelvic floor muscles. Those muscles are incredibly important and prevent incontinence and even organ prolapses, so it's time to start activating them. You can feel your pelvic floor muscles if you try to stop the flow of urine when you go to the toilet. It's not recommended that you regularly stop the flow of urine midstream as it can be harmful to your bladder. To strengthen your pelvic floor muscles, sit comfortably and squeeze the muscles 10 to 15 times. Do not hold your breath or tighten your stomach or your bottom or your thigh muscles at the same time. When you get used to doing the pelvic floor exercises, you can try holding each squeeze for a few seconds. The second exercise concerns a muscle called Transverse abdominis. You can do this by lying on your back, bending your knees so that you're in a comfortable position. Start by breathing in and out. The goal is to bring your belly button up towards the ceiling when you breathe in and then down towards your spine as you breathe out. When breathing out, make sure that you keep your spine in a neutral position and don't shift your pelvis or let it roll backwards. Repeat this 10 times every morning and every evening, and after a month you'll see the difference. The third exercise is going to target some very small muscles which often get forgotten. This exercise is called the bridge or the marching bridge. To do this, lie on your back, bending your knees and tilt your pelvis ever so slightly backwards. While breathing in, bring your belly button towards your spine, and on breathing out, the belly button goes towards the ceiling. Then, on the in-breath, squeeze your buttock muscles and start lifting your pelvis up towards the ceiling. Be aware of your back position. Keep it straight and keep breathing, and hold this position as long as you can. If it's only 5 seconds, don't worry. Your muscles have to build up and this takes time. So do it every day. Hold it from 5 seconds to 1 minute and repeat it 3 times. The fourth exercise is aimed at your oblique muscles. I'm going to show you 2 options. Pick the exercise that works best for you. The first one, you'll need to be standing again. Pay attention to your breath. While breathing out, bring your belly button towards your spine. And while breathing in, bring your belly button out. Then glide your hand down the side of your thigh while you're breathing in. Stay in that position while you breathe out, and then return back to the upright position on the in-breath. Alternate this from side to side and do this 5 times on each side. If you're not able to do as much, it's fine, it will come with time. The other option is the side knee plank. For this, lie on your side, bend your knees to 90 degrees and keep your knees together. Then make sure your elbow is right under your shoulder and start lifting your hips from the ground. Hold this as long as you can, from 5 seconds to 1 minute. The last exercise is the knee plank exercise. This one is really common. If you suffer from knee pain, you can use a pillow or even do this exercise on your bed. For this exercise, you have to be on your front. Come up onto your knees and then bring your hips up and make sure that you have your back aligned. Hey guys, I've already asked you to do this 2 times before. If you haven't done it yet and you've watched to this point, then it's the time to comment core muscles below. One of my patients was telling me that it was too late for them to do these exercises. I gave them these core exercises along with some treatment and they're back out on the golf course, pain-free. This is the end of the video. The only kind of people that have watched to this point are the people who this video is for. It's for people like you, otherwise you wouldn't have watched to this point. If you haven't commented core muscles below, then I don't know what's stopping you. If you have back pain and you think your core is to do with it, then comment core muscles. Thank you for listening and I hope you found this video helpful.